I want, okay, I would like one or two persons to just briefly remind us of what we have discussed in our last session, especially the very last one session. Okay, so the floor is yours. You can just unmute yourself if you want to give us a recap. Thank you. Anybody that wants to remind us some of the things we have discussed in our previous interactions? Hello? Okay. Let me confirm, please. Can you see my screen from your end?
Yes, sir.
We can, sir.
Okay. All right,
Yes,
that's
sir.
great. So let's have one or two to give us some kind of recap. You know, it is very important to do that before we start. That has a way of encouraging us to also know that you guys are really following, you know. So any volunteer from the house? Okay. Are we trying to trace some of our notes? Because I I can see that no hands is here. Okay. So let me just say something briefly before we start today's session. In our previous session, we talked about joint education needs assessment. And if I can remember, I was able to furnish us with some of the steps that we need to take when we want to conduct joint education needs assessment. And as part of introduction in our last session, I think we were able to categorize assessment, needs assessment, based on the level of organization, coordination, and also based on sector. So I think these are the major things we have done in our previous, the very last session. Today, we are going to look at another key important thematic area in education in emergency. Now, what I want us to know here is in emergency situations, when we are rolling out education programs, and there are certain things that has to be there. And one of the things that has to be there is the issue of mental health and psychosocial support.
So, so you are no longer audible from my end here. I don't know if you can hear me.
Same here.
Hello?
Yeah, you're audible now.
Okay, thank you very much. So thank you. Just as I was trying to give a background on what we are about to start discussing today, one of the things we need to acknowledge is in emergency settings, most of the affected population, especially the students, they are traumatized due to the conditions that prompted them to be in that emergency situation. You know, disasters usually comes and a lot of protracted crises may follow. And these are some of the things that usually causes stress, psychological distress, and trauma. And some of these things are very prevalent among affected population. So in emergencies situations, mental health issues are very common. But one thing I want us to know is that today's training, we are going to center around mental health and psychosocial support in education in emergencies. Because when we are trying to educate our affected population, there are so many things we also consider. We consider the mental health of our students. Now, just as a way of trying to have a target, today we are targeting to be able to define, describe, and explain some basic terms, especially that has to do with mental health, psychosocial well-being, stress, trauma, and resilience. These are common key words that we use, especially in this our area, anytime we are dealing with mental health and psychosocial support in education in emergencies. We are also going to describe how mental health and psychosocial interventions in education in emergencies, how they are being structured, and what are the activities and programs that we need to introduce so that as we are trying to provide education in emergencies, we are also enhancing the psychosocial well-being of our beneficiaries. Just as a way of introduction, these are some of the statistics that we have here. In conflicts and protracted crises, the natural and man-made disasters, pandemics, and other forms of adversities, they have significant acute and long-term impact on the mental health and also the well-being of children. When there is a disaster or emergency situation, it doesn't stop with adults. Even the children's well-being are also affected, their mental health, they are also affected. Now, in 2021, based on the statistics we received from Save the Children, about 449 million children, they were living in a conflict zone worldwide. This is just a statistics from Save the Children. So just imagine 449 million children, they are living in conflict zone. Conflict zone, they are zones where conflicts are going on or conflict has occurred and the students the children, they are still in emergency situations. So now, by statistics, that shows that 1 in every 6 children globally, they are living in conflict zone by these statistics. And Africa had the highest overall number of children impacted by conflict because about 180 million children are being impacted by conflict in Africa around 2021. It follows by Asia. They used to have 152 million, and Americas, they have 64 million. These are number of children that are being impacted by conflict by continents. Now, the Middle East was home to the highest proportion of children living in conflict areas. Now, in the Middle East, 1 in every 3 children they are living in conflict areas. And this is only expected to get worse because conflicts are, on increase globally. So instead of this number to reduce, the number is keep increasing, looking at conflicts, disasters and other things that are happening across the globe. Now, while Europe, they used to have the lowest and overall number of proportion of children that are impacted by conflict. They have the lowest, the Europe. So those numbers were expected to skyrocket in 2022, 2023, 2024, and even this year, 2025, because so many crises are happening, especially in Middle East, in Africa, and other continents like that. Now, these are issues that we need to know as education in emergencies specialists, because you can't just teach children that are affected by conflict or impacted by conflict without considering the mental health and psychosocial well-being of these children. Now, exposure of children to violence, atrocities, distressing events, and chronic stress without support, these children, they are at risk of lifelong effects, especially on their mental and physical health and also their general well-being. Now, and particularly, this has a direct effect on their ability to learn, to grow and develop. Most of the children that are exposed to violence in war situation, in conflict zones, sometimes due to the experience and the exposure to violence, it tends to affect them, especially how their ability to learn. Some, it has a direct bearing on their ability to grow and to develop. These are all some of the things that we need to be aware of. This is just by the way. Children, they do not cause or start wars. Yet, there is no denying that they are the biggest and most vulnerable victims in any conflict. When there is conflict anywhere in the world, children are vulnerable because sometimes they can step on bombs, without they are not aware of some of these dangers, unlike adults. Adults can decide to take some precautions, but children, they are children. And because they are children, they are more vulnerable than any other group. So, and these are some of the reasons why when they live in conflict zones, children are usually exposed to a lot of issues like that. So these are some of the pictures I can show. Some of these pictures, Gaza, Israel and Philistines, and also Ukraine and Russia, war here and there. These are some of the pictures that we can see children are in serious situations here as a result of conflict and violence. So these are just part of the introduction. So at this point, I want us to share our thoughts and feelings concerning some of these things that I have just said concerning children. Yeah. Any comments, any remark based on this? I want to hear some of your voice. So I want to hear your voice, one or two. Hello.
Hi, sir.
Yeah, if somebody has any practical experience, where children experience war or conflict, and I want us to share our thoughts. Okay?
Hello, sir.
Hello?
Yes, you quite understood that the children suffer or are more vulnerable during crisis or wars, as the case may be.
Yeah.
But then in other cases, let me say, take a situation of the Nigerian society where children are on the other side are used as agent of wars, maybe because they are recruited and brainwashed into causing damage and harm to
Yeah.
people or to life in general. So I don't know how these two issues relate,
Yeah.
but on a whole, on a holistic nature, I think children suffer more because their inability to escape or even spot danger. And the rest, why the other side, some children are being brainwashed into believing that they should be at the war.
Yeah, thank you for your comment. It is also part of the vulnerability that we are talking about. You know, if they can be easily brainwashed and be used as an instrument in war and conflict, it is also part of the vulnerability that we are talking about. You see, it is another way of exposing them to more danger. Both the children recruited and those that are victims, they are all, vulnerable to the conflict. We are talking about the general impact of the conflict on children, and that makes them even more vulnerable from the two sides. Because those that are brainwashed, carrying guns, shooting, they can even mistakenly shoot themselves because they are children. They are not properly trained. They don't know the dangers of, some of these things. So we are saying the same thing. Okay. Thank you for your insight. Let us quickly rush to the next point. Part of what we do in education in emergencies, just like I've said, we are mindful of the trauma, the stress, the psychological distress these children experience. So part of our education in emergencies component is mental health and psychosocial support activities. Now, how do we do that? Normally, when we design the timetable for our interaction with students, deliberately and intentionally, we have to introduce psychosocial activities so that we will not just continue to teach them just like what is obtainable in formal system of education. We have to create a lot of recreational activities that will help them to overcome some of these challenges they encountered, especially things that have affect their mental health and also psychosocial well-being and their general well-being. So these are some of the things that we do in education. But before we do that, there is need to look at some of these key terms that we use. I know in some of your classes here, especially MHPSS, probably you might have discussed this, so I'm not going to take more time here, but we are supposed to also look at the mental health, well-being, stress, trauma, psychosocial support, resilience, and the general mental health and psychosocial support, because these are key terms that are important in education in emergencies. Now, mental health to us is our emotional, psychological, and social well-being. And this, it affects how we think, how we feel, and how we act. If we are affected negatively by trauma and affected our mental health, it will have effect on the way we think, the way we feel, and the way we act. Let me put it that way, all our actions, they are product of thinking psychologically, because the way we think, they determines the way we feel. And the way we feel, it influences the way we act. So most of our actions, they emanate from thinking. There are connections, between the thinking, feelings, and action. So when we talk about mental health, it is our emotional, psychological, and social well-being. Now, it determines how we handle stress, how we relate to others, how we make choices. It is also important at every stage of our life, from early childhood through adulthood. At every stage of our life, our mental health is critical. It is important. And mental health is a state of mind that a person realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to contribute to his or her community. So when we have good mental health, let me put it that way, we can be productive. We can be able to deliver our tasks, and we can contribute, fruitfully to our communities, to the society at large, to our families. That is mental health. But when our mental health is affected, we may not be able to even cope with normal stress that normally people can cope with. If your mental health is affected, you may not be able to cope with them. Now, on the other hand, we also made mention of well-being. Well-being is the state of health, happiness, and prosperity. Now, for well-being, we have so many forms. We have personal well-being. This has to do with positive thoughts, emotions such as hopefulness, calm, self-esteem, and self-confidence. These are all personal well-being, and they are positive thoughts and emotions. We also have another aspect of well-being, which is interpersonal well-being. This is nurturing relationship, a sense of belonging, the ability to be close to others, talking about interpersonal well-being. We also have skills and knowledge, the capacity to learn. These are all part of our well-being. Make positive decisions, effectively respond to life challenges, and express oneself. The mental well-being is the ability to handle life and its various stresses and challenges. Because when you have a good mental well-being, one can be able to handle the normal challenges of life, and also stress and other challenges that are unavoidable. Now, all these things that we are trying to operationalize, we are heading to psychosocial well-being, which is PWB. And this is a necessary condition for any human being. Any human being to realize their full potential and to lead a fulfilling, healthy, and productive lives. So part of what we do in education in emergencies is to enhance the psychosocial well-being of our beneficiaries, especially the students, the pupils that we have in our temporary learning centers, in either IDP camps or in host communities. Now, when we talk about psychosocial well-being, we need to understand that these are necessary conditions for any human being if we want to realize our full potential to lead a fulfilling and healthy and productive lives. When our psychosocial well-being is down, it has a way of affecting every aspect of our life. And that is why part part of the components in education in emergencies is trying to enhance the psychosocial well-being of our beneficiaries. Now, what are the indicators of this psychosocial well-being? Anybody that has good psychosocial well-being, the aspect of confidence is there, self-esteem is there, feeling safe, ability to solve problems, make informed decisions, build positive social relationships, work together and resolve conflicts. These are indicators of psychosocial well-being. So sometimes when children are affected by violence, by conflict, it has a way of affecting their confidence. It has a way of affecting their self-esteem. It has direct effect on their safety. Some of them, they may feel unsecured because of the exposure to violence. Some of them, it has direct bearing on how to solve problems. Some of them cannot even make decisions, and also inability to build positive social relationships. Some of them, they cannot even solve problems normally that they are supposed to solve at the stage of their lives. Now, these are all indicators of psychosocial well-being. And when we introduce mental health and psychosocial support activities in education, it has a way of helping our beneficiaries to be healed from some of these mental health issues. Probably they might have developed as a result of the violence, the conflict, and other things that happens. And that will also help them to overcome that and be able to learn, grow, and develop. That is the concept. Because without taking care of their mental health aspect, it may have a direct issues with how they learn. Let me give you some practical examples. When a child is exposed to violence, some of them, they are likely to develop anxiety. Some may develop depression. Some may develop post-traumatic stress disorder. Some of these children may develop other mental health disorders. And some of these mental health disorders, it may affect how these children learn, how they grow, and how they developed. So there are connections. And that is why education in emergencies, we have to also take care of the mental health of the beneficiaries and also trying to teach them the content, the curriculum. We have to teach them and also take care of their mental health through mental health and psychosocial support activities. At this point, let me slow down. If you have any question or what we are saying is not clear, maybe you can just indicate so that we can make more clarification. We are talking about even the rationale for integrating mental health and psychosocial support programs into education in emergencies. So any question, please, from the house? Hello, I hope I am still in the house.
Yes, sir. Yes, sir. You're still here. We can hear you.
Okay, that's great. Yeah, so it seems there is no question. Let's look at some of the way some of these things affect even adults, because when we talk about the exposure to violence, exposure to psychological distress. These are part of what happens when there are crises, when there are conflicts, when there are disasters. So let's talk about the stress, how it affects both the children, the adult, and the people that are exposed, to violence and other forms of disasters. Now, when we are looking at this, I want us to know that stress is a normal reaction to a threat. Stress is something that is a disturbing change in environment, especially the stressor, that has capacity to cause both physiological and psychological responses. So anytime we talk about stress, we need to see it as a normal reaction to a threat or a disturbing change. Something has to happen, especially in the environment, that causes our body or our psyche to respond. And sometimes when our body responds physically or in our psychological being, we respond. These are what we call a stress. So stress is a normal reaction. This is how I want us to look at it, because sometimes we cannot avoid it. Now, it occurs when any demand is placed upon the body. And it can come from any event or negative thought. Sometimes we don't need to even run. We don't need to do any physical activity for us to experience stress. Sometimes even from our thoughts, it can come. So it is a normal, automatic, physical, and emotional reaction to the event. Whether we are conscious or unconscious, sometimes it can be our reaction to certain events, and it is a stress. It is necessary for our survival, for growth and development. In fact, there are times that stress can help us to do our best. Maybe you are face to face with exams. It can be stressful, but that level of stress can push one to bring out the best in the person and even, pass that particular exams. And one thing with stress, it can be avoided. We can manage it, and stress is preventable. Sometimes we can prevent some stress, especially when we are fully aware of the situation. So stress is something that we see it as a normal thing, but there is also one thing I want us to understand. Stress can kill. And stress, if it is not properly handled, it can lead to so many other issues. Now, talking about stress, we have types of stress. We have one that is called acute stress. This is just a short-time body's reaction to a new or challenging situation. People are living in their normal life, and maybe something happens. It will definitely bring about new challenges. So for acute stress, it is just a short-time body's reaction to a new or challenging situation. Maybe deadlines, maybe the nature of your work has to do with deadlines. It can lead to stress. We also have another one which is called episodic acute stress. Is when an acute stress is happen on a frequent basis. It can lead to this. It is a bit higher than the acute stress. Then we also have the chronic stress. This is the result of the stressors that continue for a long period of time. The chronic stress, most of our people that are affected by crisis, especially children, some of them they are exposed to chronic stress because after displacement, they may have moved to another location. Maybe location that is not familiar, location that they are no longer enjoying the place, such as IDP camps or refugee camps. And from there, probably a lot of challenges may also be there, and they may be having constant, challenges there. So this is an example of chronic stress. Another examples we can give to that is maybe when you have a situation where two partners, a man and a woman, always fighting, that can also that can lead to chronic stress, and that is the reason why I said sometimes if you don't properly manage stress, it can lead to death, it can lead to other health condition like that. But for our own, what I want us to note here is most of our children that are living in conflict zones, they are exposed to chronic stress. Some of them, they are, where they used to play are destroyed. Schools are destroyed. Houses, homes are probably destroyed. And they are just moving from, place to place. Some may end up in the hospital. Some may end up in another place like that, open place. Okay, so there are so many challenges that can expose our children to chronic stress. So this is, by the way, the stress. Also, there are stressors, things that usually cause stress. So these are called stressors. These things, they can be a person, they can be a place, it may be an event or situation, or any stimulus that cause physical or emotional stress. They are called stressors. Now, some people, examinations can be their stressor. Divorce. Sometimes when people go their separate ways, the wife carry her bag. She say, I will not continue in this marriage. The man say, you can go, shut down the house. It can also lead to stress. When she left, probably they separated physically, they are emotionally and psychologically connected. And because of that, anywhere they meet or anyhow where they see themselves, the tension is also there, and the stress, it will ignite stress. And these are called stressors. Death of a cherished one. You love somebody and the person died, it can also cause stress. Moving to the new location, it can also be a stressor. Loss of a job or health problems. Some people that are battling with physical health, maybe in and out of hospitals, it can also lead to stress, both to the patient and also the caregivers. Okay, relationship problems, boyfriends and girlfriends, all these kind of problems, it can also lead to stress. Financial strain. Some people, when they have money, they are less stressful. When they don't have money in bank account, in the pocket, it is a source of stress. or increase in work responsibilities. Maybe you are tasked with a lot of activities. So it can also cause a stress. These are stressors. War can also lead to that. It can trigger stress, bad marriage, and so on and so forth. So these are what we call stressors, and it can have effect on our system. Now, how can we know when somebody is experiencing a stress? Be it a child, adult, adolescents, there are so many signs that we can tell if someone is having stress. Some it may show in a form of physical, some it can be psychological or emotional. But in most cases, the physical ones, you can see some complaining of headaches or muscles aches or irritability and anger. Some people, when they are stressful, that is when they will show their anger, a weak immune system, heartburn. Some will experience a serious chest pain when they are stressed. Some it can even lead to difficulty in breathing and relaxing. Some, their body may be shivering, shaking, and dizziness may set in. For some adults, they may even have trouble in having sex, especially men. When they are really stressful, no woman can convince them to lie with them. Stomach and digestive problems, these are also signs. Some will be grinding or clenching their teeth, trouble sleeping, and so on. These are signs of stress. And also, there are effects. When people are exposed to stress, there are some certain effects that can follow. Physical illness, especially heart diseases. Some people, when they experience chronic stress, the physical illness will set in. It may lead to heart-related diseases, violent action. Some it may lead to anger outburst like that. Okay, mental disorders. Some, especially the children and women, some frequent crying. It can also be some effects of this, fatigue, and so on and so forth. Now, these are some of the ways we can experience stress and the stressors, the signs and the effects. Now, how to cope with some of these stress that we are talking about? There are so many ways that we can help, especially our beneficiaries, on how to manage some of this stress. We can expose them to physical and mental relaxation. It has a way of reducing the stress. Also, exercise and diet is also one way that we can assist them to manage some of this stress. Deep breathing, these are some of the things that we expose them to. Meditation. We also need to identify the triggers and eliminate them. We can also advise them to make out times for their hobbies, build resilience among them. We also encourage them to talk it out, sleep, and we encourage them to be assertive, reduce noise, and manage their time, creating bounds, especially when you notice some of your stressors, they are from either people, event, or places. Somebody can create a bound. If you know that going to this place will also cause you stress, then you reduce, don't go. If meeting this person always causes you stress, when you know that the person is coming, leave the place, let the person come and go. You don't need to meet the person. So these are what we call, you can create boundaries to avoid some of these stressors. It is also another way to cope or to manage stress. And also, when you have a serious and chronic stress, we also recommend people to see or to talk to specialists, especially counseling psychologists, clinical psychologists, or social workers, and so on and so forth, or any other mental health expert. So these are for the stress. Okay. So why are we talking about stress here? We are talking about stress here because our children that are living in conflict zones, they are exposed to a lot of stressors because of the condition they find themselves. And this is the reason why anytime we are rolling out education in emergencies programs, we have to factor mental health and psychosocial support activities to ensure that we also help them to cope with these stresses, with psychological distress, and the trauma they have experienced or they are experiencing. So let me also slow down at this point and entertain questions and contributions. Any question? Okay, Miriam, go ahead. Yeah.
All right, good afternoon, sir. Thank you so
Yeah,
much for this impactful class. I've actually learned so much from
that's
this
great.
lecture. Okay, but I have just one question. Under signs of stress, you mentioned insomnia, and then you said again under how to deal or cope with stress, you said we should sleep. So I don't understand. Somebody who is finding it difficult to sleep, how does the person cope with sleeping again as in how
Well,
does
thank you for your question. You see, some of the effects, it can cause somebody not to sleep, right? So some people, when you ask them to sleep, you can guide them on how to do that. You know, there are some people, when they want to sleep, they prefer to sleep when the light is off. So you will ask them, and when you discover that these are the necessary conditions they require to sleep, you can just guide them to sleep. If they are still having problems, difficulty to sleep, that means you can advise them to see a psychotherapist for further interventions. So this is what we mean by telling them to sleep. Because some of them, by telling them to sleep, you will also discuss other things that they need to put in place before they can sleep. Okay? I hope that helps.
Yes, sir. Thank you, sir.
Thank you. I can see Doshima. Go ahead. Hello. Doshima, you want to say something?
Yes, good evening, doctor.
Yeah, good
Good
evening.
evening, everyone.
Yeah,
In fact, I think this is one of my best topic in education in emergencies.
that's great.
And
Yeah.
I don't know if this is a question or I'm just trying to ask something that we have always failed to understand for a very long time.
Okay.
You know, while I was listening to this class, I remember there was a time when I think there were crises somewhere. I think we were working with IITA. And then there was a place that there were crises and people ran away and we went to this area and the children were playing. And then
Yeah.
someone said, can you imagine that children, they don't even know what is happening. They're just playing all over. So this
Yeah.
has been happening for a very long time. And all this while, we fail to understand that children also go through stress. We
Yeah.
just see them and we feel that, oh, they are enjoying their lives. They don't really know what is happening. So this class has really, really opened my eyes because I personally didn't know that children go through stress like this, like just what you just explained today. And it's
Yeah.
really, really very helpful to me. And I love the way that you're able to break it down in a way that
Yeah.
I understood perfectly well. And from today, I don't think I will ever think like that again. We always
Thank
think that
you.
you go through stress. We
Thank you
always
very much for your contribution. Thank you. I can see Kristen, you want to say something?
All right.
Yeah.
Good afternoon, doctor. And
Afternoon.
so far, so good. This has been very impactful. The pace which you are moving, slow and steady. The thing is really going where it should go.
Thank you.
In education in emergency, just like you said, in trying to be practical, you will find, let's say you want to implement an education program in a crisis zone area. Now, this education mostly has to do with children. And looking at the category of people that fall under stress and things that trigger stress. Your concern now, the concern about this very education emergency is probably the children. So in a practical, who deals with the adult and the parents that are also into one form of stress or another in this very context?
Okay, thank you very much for this wonderful question. You see, if you look at humanitarian structure, the coordination system, that component, mental health and psychosocial support, it is not a sector, but it is what we call a technical committee. And this mental health and psychosocial support, it is one area that you can integrate it into all the other sectors. If you go to WASH, there is component of mental health and psychosocial support. If you also look at nutrition, there is also a component of mental health and psychosocial support. The same thing with shelter and other sectors in humanitarian. Why is it so? It is so because it has been established that both the adult, the children, and any other person in humanitarian emergencies situation, because of the exposure to violence, the conflict, and other things, they are stressed, they are traumatized, and whatever services we are to render to them, we have to be mindful of their mental health and psychosocial well-being. Now, those other sectors that are giving their services to adults, they are also taking care of the adults' mental health and psychosocial well-being. Now, in education in emergencies, we also have teachers that are supposed to teach these children. These teachers, some of them, they are also traumatized. Some of them, they are displaced. So in the course of implementation, we normally provide services to the teachers. We teach them, give them psychoeducation on some of these things that we are discussing. Sometimes if we discover they are suffering from severe mental health issues, we can also provide psychological intervention to help them, or psychiatric intervention depending on the level of the issue at hand. So other sectors are also trying in that direction. But the reason why we focus more on children, it is because most of our beneficiaries in education in emergencies, they are children, school-age children. That is why we are biased when we are discussing it here. I hope that helps.
Very well, sir. Thank you
All
very
right.
much.
All right, thank you. So let's make progress. The next, we also have the issue of trauma. We said that these children, when they are exposed to violence, they are stressed, they are traumatized, and some of them, they also experience psychological distress. Now, the aspect of trauma, what is trauma? That is the question we need to understand. The trauma is what I call senior brother to stress. It is higher than stress because trauma, it has a way of even killing people at the point they are experiencing it. So most of the time, trauma is the response to a deeply distressing, disturbing event that overwhelms one's ability to cope. When people are in trauma, they cannot be able to cope. Why? Because they lack the ability. It is something that overwhelms them and it is disturbing, and they cannot be able to cope in that situation. Now, when we talk about trauma, there are things we need to know about it. Traumatic situations, one can be exposed to it by experience, by witness, or by learning. Sometimes what we experience and call trauma is not something that happens to us directly, but even some of the things we see, we witness. For instance, somebody may be traveling, this is just an example, and if there is an accident, at the point the car is somersaulting, it is a traumatic situation, right? The persons that are in the car, at that point, we can classify them as they are experiencing trauma. At that particular point, they cannot be able to cope. They don't have control over the situation. They may survive it, they may not survive it. But this is direct experience of traumatic situations. Now, there are also instances when people can be traumatized, not being experiencing it. They can just witness it. It is also part of the exposure. For instance, if armed robbers enter somebody's house and the person has wife, daughter, they did not beat the man, but at the point of gun, maybe the armed robbers raped the wife or the daughter. At that point, the victim is witnessing what is happening. And because it is a traumatic situation, it is also exposure to trauma. Or sometimes when a horrible experience happens, when people come and share it with others, people will learn from it. And when they learn it, it can also be an exposure, to trauma. Let me give another example here. Maybe you lived with somebody or some set of people in a village, and you later leave the village to a city, and you heard that maybe something happens to them, the people you left behind. Maybe some armed groups came to the place, killed them. You didn't experience it, you did not witness it, but maybe one survivor among them managed to escape to the city and tells you what happened. You see, you learn from what happened. You, the person that learned, can also be exposed to traumatic situations, because by the time they are telling you, you are remembering the place. You can even recall some of the people that you lived with them. So these are so many media that one can be exposed to traumatic situations. Now, when we talk about trauma, it has to be physical or psychological. Sometimes it is physical, sometimes it is psychological. Now, if you go to most of the modern teaching hospitals, they have trauma center. What do they do there? They tackle the physical trauma. When people are traumatized, some may sustain fracture, some may experience some kind of injuries. Okay? So when you take them to trauma center in hospitals, the trauma center is there to take care of the physical injuries and other things. But we also have the psychological trauma. That is where the major issue is. And this psychological trauma, we have to use a lot of psychological interventions to tackle them because they are psychological in nature. And that is why all the issue of mental health and psychosocial support activities has to come alongside with the education in emergencies so that we can help them to build resilience and to bounce back from the traumas they experience. Now, trauma is a physiological, psychological, and emotional response to a terrible event. It is also a response. Sometimes it can be physical in nature, sometimes it is psychological or emotional response. So it all depends on how it happens, but that is trauma for you. So trauma, it can be described as physical, emotional wound with severe psychological repercussions on individuals. When people are traumatized, sometimes you will not see any physical wound on them, but the pain they are feeling cannot be quantified. And that is why it has some psychological repercussions on individuals. Traumas can kill instantly, and it can sometimes directly cause mental health problems or make one vulnerable to developing some of these mental health problems. Now, people that experience trauma, there are certain signs that one can be able to see in them. It depends on individual, it depends on so many factors, but there are signs, some of these signs or symptoms, they are also signs of some of these mental health issues that we have been talking about. Now, some people, because of the trauma they experience, they will be experiencing abnormal heartbeat. We call it racing. Their heartbeat may be faster than normal because of the trauma they experience. And it will continue like that and continue like that even after everything has calmed down, but it will just continue like that. Anger, anxiety, behavioral agitation, regress to younger behavior. This is very common among children. Children that are traumatized, some of them, they behave like their younger ones. Some things that at their age they are not supposed to do or not be, they are supposed to do. So sometimes they may not be able to do it or they can't do it because of the trauma they experience. Also, it has a way of affecting our eating pattern, irritability, social withdrawal. Some children, when they are traumatized, they isolate themselves. We call it self-isolation. They isolate themselves. Fear. Some of them, they are in fear, always afraid because of the trauma. And also, other signs that people experience when they are traumatized, some it can be aggression, shame, denial, hallucination, difficulty in concentration, especially our students. They cannot concentrate when teachers are teaching them because of the experience, and exposure to traumatic situations. Emotional outburst, flashback, and frustration. Now, this flashback is one of the symptoms of post-traumatic stress disorder. I have once see somebody that she was in captivity and they rescued her. And when she came back to the camp, anytime a chopper flying over the camp, she will begin to experience flashback. She may begin to think maybe the military came to attack the armed group camps, because that was her experience in the bush. Most of the time when military, went, they can attack them. And at that point, shooting here and there. So she survived it. But when she finally came to the camp, she was experiencing flashback of some of these things that happened. Sometimes, even when there was nothing like a chopper, she will just begin to run as if something is happening. So also guilt and hostility, hypervigilance, insomnia, difficulty in falling and staying asleep. Jealousy is also one of the signs. Loneliness, loss of interest, especially in activities once enjoyed, loss of memory. Some of them, after experiencing trauma, they lose memory, they cannot remember some of the things that happened in the past. Loss of self-esteem, mistrust. Some of them, they can never trust people again. Probably somebody betrayed them and they experience trauma. So they will try and build on that, not to trust anybody again, mistrust. Loss of sense of belonging, especially within group. Nightmares. Sometimes they will be having terrible nightmares. Poor concentration, poor academic activities, poor retention, sadness, self-criticism, and self-destructive behavior. Some of them, they will not even take care of their hygiene because of the trauma they experienced in the past. Slow recall, excessive worry, bedwetting, and so on and so forth. These are signs of trauma. Now, trauma, it has consequences. And consequences may affect the overall lives of its sufferers because it is associated with a lot of unfavorable personal, social, academic, economic, and vocational consequences. Any area of our life, it can be affected by trauma. In our personal life, our social life, academic life, economic, and our vocations. It has effect on them. So when we are talking about trauma, trauma is deadly and it has a way of causing more psychological pain and also psychological issues on our children, on our teachers, on their parents, and even other members of the community. Now, there are also consequences like risky and self-destructive behavior. Most of the people that are traumatized, especially adults, some they resort into risky and self-destructive behavior. Excessive smoking or drinking, these are, signs of part of what we are talking about, risky behavior. If you go to the camp, you will see a lot of children engaging in, they are engaging in excessive sex. These are some of the repercussions of trauma. And also it can lead to mental health issues, just like I've said, the PTSD, depressive and anxiety disorders, and also abuse of illicit drugs. Some of them, they resort to taking hard drugs, less attention to personal appearances. Some can even harm themselves or commit suicide And some, it can lead to death automatically. Because once they are exposed to trauma and they just manage to survive it, in short time, you will just hear death. I once experienced, I saw somebody experiencing that in one camp in Adamawa State. The person used to be a very rich person in the village. You know, this village, he has money, he has so many farms, business, and everything there. So he used to send some of his farm produce to as far as Lagos, Ibadan, and other places like that. Very rich person, but residing in a village. And he used to have a lot of people working under him. So when this Boko Haram came, they destroyed everything, and the man managed to escape to Yola, Adamawa State. And when he reached the camp, they decided to give him one small plate like that for collection of food. You know, when they get to the camp, one of the ways to welcome them is to give them some basic things they can use, you know, some things like pot plates and other things like that. So he was given a plate for collection of food. He was even asking for what? They said at a time when they cook, you guys, you have to line up, collect food and eat, you know. So people were collecting food. He refused to join the queue. And the camp manager asked him why. So he was telling the camp manager that I don't think I can survive this because I used to be very rich. I can even feed all the people in this camp. So today, how can I join queue and go and collect just a plate of food for survival? So he was thinking that cannot continue. In less than 2 weeks in the camp, the man died like that. He did not commit suicide, just in a sleep. He just slept and he died, you know. So these are some of the, consequences of trauma. Trauma, it has a serious consequences, unlike stress. Stress can also kill, but trauma, it has serious repercussions, especially psychological repercussions. So at this point, let me also slow down and entertain questions. If you have any questions or contributions, you can make your contributions as we proceed. Any questions, please, from the house or contribution? Have you seen somebody experience trauma in the past? Okay. Hello. Okay, go ahead,
Yes, sir.
Enes.
Hello, sir.
Yeah, go ahead. Yeah.
Sir, can prolonged trauma lead to mental health?
Yes.
Yes, and then the second one is if you experience trauma, maybe by losing someone so dear to you,
Yeah.
is there any therapy that can make you maybe
Yes.
alleviate it?
We have in counseling what we've called grief therapy. It is very effective in that department. When people lose their loved ones, we normally give them grief therapy. It is very, very effective, and it has been tested by many researchers, and it is efficacious in dealing with some of these issues. Okay. Any more comments, contributions from the house? I hope that helps, Enes.
A lot, sir. Thank you, sir.
Yeah, thank you. Okay, John, go ahead.
Okay, sir. My question is, does trauma have any positive effects?
Well, so far, I don't think there is any positive effect dictated, especially in the literature, because trauma is something that we avoid, and when it happens, it is something that is usually beyond our control, and it is negative in nature because many people they could not survive it. And that is why in emergency situation, most of the time, if you see us saying survivors, we are referring to people who survive trauma. So trauma is something entirely negative. Okay, thank you.
All right, sir. Why I ask that question? Like I've seen someone who experienced, okay, let's say he experienced an accident.
Okay,
He survived the accident.
yeah,
He loses a friend, a close friend.
yeah,
After these two incidents, he no longer have fear of either accident of death any longer. Like he will tell you he is no longer scared of anything. He lives his
anything,
life
yeah.
just like that. That's why I was asking if there's any positive effects.
Let me say something at this point. You see, this is abnormal because when somebody is thinking in that direction, it is not normal. Why is it not normal? Normally, we are supposed to be afraid of death. Normally, it is in our nature, right? So if somebody experience any deviation from the norm, it is something that we can categorize it as abnormality. And some of this abnormality, it is not good for us. Let me put it that way. Anybody that is not scared of death can take any risks. And some of these risks, it can also expose the person to more danger. So I don't think it is something, there is nothing positive in it, in trauma. Yeah, thank you.
Thank you very much, sir.
Thank you. Monica, go ahead. I can see so many hands. Let me start with Monica. Go ahead.
Okay, thank you very much, sir,
Yeah,
for the impactful lecture.
yeah.
I want to ask, will prolonged stress aggravate to trauma?
Okay. Well, if you look at the definition of the two, they are not the same. And the chronic stress, which we classify it as something that keeps happening more often and it is prolonged, it is still stress. And one thing about stress is it can be managed. But for trauma usually happens suddenly. And sometimes when it happens, it is something that we cannot be able to control. That is one thing with trauma. But for stress, we can control it. We can prevent it. We can manage it. So the prolonged stress may never lead to trauma, but it may also have other repercussions because stress also kills. But trauma and stress, they are two different things. And there is a clear distinctions between them. Okay? I have given so many examples on how trauma happens. If you want to know how it happens, just consider what we call traumatic situation. Something that may happen suddenly and one cannot control it. And because of the overwhelming, disturbing event that happened, it results to other psychological or physical effects. So sometimes even physical injuries, like I have given an examples with accident. Where somebody is traveling and the brake, fails. So the car begins to somersault. Now, when the car is somersaulting, that episode is what we call episodic traumatic situation. Okay, so this is entirely different from stress. Stress, normally it usually comes slow, 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 and before you know, it can lead to other issues. Okay, I hope that helps, Monica.
Yes, sir.
Miriam,
Thank you, sir.
you're welcome. Miriam, go ahead.
All right, thank you, doctor.
Yeah,
Please, sir, I want to understand if there's a distinctive difference between shock and trauma. Because I remember there was this incident that happened where a school collapsed somewhere in Plateau State there at
yeah.
Jos, that a woman lost her 3 kids on the spot. And then when
Yeah,
she was called to the school, and when she got there and was informed about the incident that happened,
yeah,
and then the woman just collapsed, and that was it. She died.
yeah.
So
You
I
see,
want to know.
yeah, I understand what you are saying. Thank you. Some of these things, there are terminologies in certain professions. Maybe laymen, people that are not professionals, they can classify it as shock. This is their language. It is just an issue of language. If you look at the literal definition of shock, it may not be just what you have described, because what you described there, it was a traumatic situation. Building collapsing and fell on her children, right? So when she discovered
Yes,
it,
sir.
what does that mean? She learned the traumatic experience, the traumatic situation. When the building fell, she was not in the building. That means she did not experience the trauma. Now, she had it and she came. When she came, she saw it. And when she saw it, that means she witnessed it and she learned that this thing happens and it happens to her children. So definitely, she fell. So this is what we are saying. Some exposure to traumatic situation does not require a person to experience it directly, but you can witness something and be traumatized. You can also learning and be traumatized. But this is just a language. That is what I want to believe. There are so many things when you hear laymen say it, you begin to imagine, where do they bring these words? If you check the professional dictionary, it is not there. If you check the English dictionary, the meaning is different from what people are saying. So shock and trauma, to me, it is just a language of professionals and the laymen.
Okay,
Just like blood pressure now. If you hear doctors talking about blood pressure and stroke and all these things, they exactly know what they means. But sometimes, people can have misconception of them and just be using it. Yeah, thank you. I can also see so many hands.
thank you, sir.
All right, that's great. Isaac, go ahead. Isaac. Isaac, the floor is yours. Okay.
Sorry, good evening, sir.
Yeah, good evening.
So I so much in love with this your topic, sir. So much happy
Thank you.
coming across this topic because myself, I'm a living example. I'm still struggling up to now.
Wow.
I don't know whether it was trauma. I don't know whether it was stress, but I lost my father, and I feel from that time I've never remained the same. I only struggle on my own, nobody to advise, but
Yeah.
the determination, and I even faced challenges. I went out, I met a boss, and along the line, the boss got killed by armed robbers. That very day, he took me out, and I went home. I came back the next day. They say he didn't come back. So
Wow.
the shock that I received from the news, hearing the news of his death,
Yeah.
battled with the condition of the sudden death of my dad, and to the fact that I have so many uncles and nobody was there to even call. I have so many brothers, nobody to call, so many uncles, nobody to know my whereabouts, nothing.
Yeah.
The thing really got me aback. But I thank God for today.
Yeah.
And many of those symptoms you mentioned, is almost all of them I passed through them. I passed through them a lot. I have an inability to forget. I said at a certain point, I thought I lost my senses. I lost my listening, but I thank God today. So my question is that, can trauma lead to madness, which I'm believing it could? And if it does, can someone that run to God madness or is mad as a result of trauma, can such person be revived?
Yeah, let me also say something at this point. This issue of madness that people are saying, it is also a layman's language. So when we are talking about trauma, it can lead to mental health disorders. And these mental health disorders, there are so many. Probably when somebody is exposed to trauma, some may develop anxiety, some may develop depression, some may develop post-traumatic stress disorder. These are distinct mental health. They have treatments. So that is one thing I want us to understand, that all these things, they are like physical diseases, malaria, typhoid, and co. They are diseases, but they are mental health issues. And these mental health issues, they can be treated. We can use psychological interventions to treat them. We can even use the mental health and psychosocial support activities and manage them. We can also use psychiatric intervention and handle them. Use of medicine and, psychotherapy. So there are so many ways that we can handle them and they can be treated. But one thing I want us to understand here is, first, there is need to consult a specialist who will be able to identify exactly what areas are you having the problems. Because when somebody is traumatized, you may experience a lot of symptoms and signs, but after some time, the real issue will manifest. Some people can even bounce back and continue their lives without developing any mental health issues. So I want you to look around, especially where you are, if you can get a specialist, especially a psychologist by training, and interact with the person. I want to believe it will go a long way in overcoming some of these issues. I am a very busy person, and I always move around. I am managing currently a project in 19 states in Nigeria, all the northern states. And most of the time, I am always on transit. Like now, I'm in Makodi from Kefi. If not, I can book an appointment with you privately, one-on-one, so that we can have a deeper conversation on this. But I want to believe that if you have any around, fine. If you cannot be able to get any, even in the night, we can maybe get a 30 minutes or an hour with you once in a week. Maybe if we can have roughly 6 sessions, I think that will help. Okay? So I want to assure you that there is a treatment, and some of these treatments psychotherapy. There is no any side effect, no administering of drugs. But there are also other treatments like psychiatric intervention where there is need to administer some drugs and it can be treated if we are able to diagnose any issue with you. So I want you to become and know that there is a remedy for it. Okay, thank you very much. I hope that helps.
Thank you, sir, so much. It helps
Yeah.
a lot because as I'm speaking to you myself, I know that I have a sister that suddenly I saw her condition. It was very devastating. My immediate sister. So she got married at my absence, and my brothers were not there to check on her. So in my absence, when I came back, I just saw that she was at that very state. Now she can't even imagine herself, and as it is in village now, I don't know. Kind of taking it to be me something witchcraft or something like that, which I don't mean to me because when I spoke to her, when the things calm down, she will speak normal, very normal, and I believe that she must have been traumatized to put her to that condition.
It leads to that.
I
Let me share one experience that I encounter in that I've seen practically. You know, there was a woman around about 6 or 7 years ago in Maiduguri. Her children, she used to have about 10 or 11 children, one elderly woman like that. And one day, 9 of her children, all males children, because one of them, according to, she is in her husband's house, a female, but the 9, they are all males children, and they went to farm, to go and farm in one area. Konduga local government is just 20 kilometers away from Maiduguri. It's not far. They usually go to farm and come back to the city, Maiduguri. So we were living in the same area with the mother, and these children, they went to the farm to go and farm. An armed group came and attacked them in the farm and captured all of them and slaughtered them. All the 9 children. So when they brought the news to the woman in her house, in our area, we were there. When they now announced it to her, they said, Madam, please, you have to take it easy because what we are about to tell you, it is something that, because they can't hide it from her. So they open up and explain it to her. Initially, she was saying no. But when she saw how they brought them, and normally Muslims, they don't waste time when something happens like that. They will just bury them that day. So when she discovered people came and they organized the burial and, they went and buried them, immediately the woman developed what we call psychotic disorder. She was not in tune with the reality. She began to mention the names of these children, calling them to come. And she will call and call and call, and she will keep quiet and cry for some time. She refused to eat. Sometimes she will be hearing their voice according to her hallucination. So immediately she developed what we call schizophrenic disorder or psychotic disorder. So these are some of the issues, that are traumatized, that can lead people, even in 24 hours, to lose whatever sense they have. So these are horrible. Just imagine a person losing 9 children, her biological children, in the same day. Not even in week or year, in the same day, 9 children. So these are issues that sometimes they can be shocking, according to laymen. They can be traumatic in nature, but so many things are responsible for that. Even some women in their husband's house, because of physical violence, and other maltreatment, they may end up having issues like that, you know. So there are so many issues around some of these things that we are talking about. Okay. So thank you very much for sharing your experience, but I want to assure you that there is remedy for the problem. All you need to do is to consult people that are specialists around. They can guide you on the steps and steps and steps you need to follow. The first line of treatment, I say, is psychotherapy. If it is not effective, they can combine it with psychiatric intervention. From there, they can now see how they can take it up to other specialists. But I believe it is something that can be managed, and it is something that has been treated in the past, and it can be treated. So thank you.
Thank you so much, sir.
You're highly welcome. I can see Ezekiel, you want to say something? Emmanuel Ezekiel.
Yes, sir.
Okay, go ahead. Yeah.
Thank you so much. I really appreciate all these lectures, and I believe all of us, and not even most of us, are really enjoying it and are blessed. Personally, I
Yeah,
want to appreciate you.
that's great.
I think this his scenario, if it's not like mine, I think it's just what I'm feeling and what I'm going through.
Wow.
Just a year ago, I think I have that experience. After I was done with my day, I was done with my activity, my phone was in charge. I come back, let me just on it and do one or two things before I go to the house to close my shop.
Yeah.
It wasn't long, I just received a call. And I
Yeah.
was trying to say, it's Momsi. I talked to her yesterday. I heard that she's not feeling too well. They say,
Yeah.
which Momsi? So it means she have died hours ago. They have been looking for me.
Wow.
My phone is off. You know,
Wow.
the shock I trek, I don't know either you know Meduguri, from Tashambama to this. I trek
Yes.
on foot. I was
Wow.
just like I was do exercise. I was just shedding tears, crying.
Wow.
I can't take it.
Wow.
But I don't want anybody to tell me don't cry, sorry, whatever. So I just want to
Yeah.
really cry. So I
That's
trekked
great.
down, I was expressing it. But I'm telling you, for about a week, my mom keep coming back to come and tell me sorry.
Wow.
She have to go. It's just like a dream, but I feel it
Yeah.
like a reality every night. Even that same
Mm.
night, I saw her coming to comfort me. It was not her fault. The pain is too
Wow.
much. I have to go. If it is
Yeah.
someone that is telling me, I may think the person is just cooking it, but that is my reality.
Yeah.
After a long while, and I see the thing just dropping down, dropping down. So it's not easy, but sometimes we have to just take it and continue with life because
Yeah.
I felt everybody know that everyone would die. But sometimes there is this
Yeah.
connection between you and somebody that you expect. Okay, there are some things you guys are supposed to be done with before now. Before now, it's not like somebody is old or it's not old. No, that connection. But I
Yeah.
believe the right time is for everyone, and when the time comes, we all go. So
Yeah.
truly, I want to know the difference between that shock and that trauma, apart
Yeah.
from the layman or not layman, how do you differentiate it? Because when you explain me, I wanted to just say a word that to even hold me down to say, okay, because like the woman you said, she go to the building and saw that it has happened and she now collapsed there and died.
Yeah.
If you call that one trauma, she was traumatized and she died. But shock is
Yes.
like something happened to you. This thing happened. So but I
Yeah.
don't know. Maybe English can just
Um,
make you just change
yeah. Thank
the
you very
topic.
much. I understand exactly what you are saying, but I want us to know that when we talk of trauma, I made mention exposure to a traumatic situation, right? And that exposure, it is not you being experiencing it direct. No, sometimes there are three major ways where people can be traumatized. Now, number one is you may have direct experience. Maybe the thing happens to you direct. For instance, the victims of rape, they are traumatized, but they are in the action. They are victims. Some people molested them, right? Now, sometimes it can also be a witness. one thing with trauma is it's not always about experiencing it. Sometimes you can just be there witnessing what is happening and you can be traumatized. Nothing happens, nothing shakes you, even one hair, nothing touches you, but you can be traumatized. I have given an instance. Maybe armed robbers come to somebody's house and raped his wife or daughter in the presence of the person. Just imagine the pain, the father or the husband will witness there. So these are, you witness the horrible thing, and at the end, you are exposed to traumatic situation, then learning. Then where the issue of layman or not layman is, if you notice this issue of shock, when electric current shocks somebody, there must be a contact between the physical body of the person and the electric cable, right? And
Yes.
when somebody touches the cable, the cable will shake the person, and so many things may happen. Now, the issue of shock that people are talking about, sometimes they may just be, linking it with some of these things, and it is a matter of like a language. But in terms of professionalism, this can be described as traumatic situation. So the issue of shock or not shock, I don't think, because in our profession, the laymen are the ones saying shock. Okay, it is something that that maybe has can shake somebody. Let me put it that way. But in real sense, there was no any physical contact. No, nothing shakes anything, but it's just like something that overwhelms somebody, disturbing something that that is beyond the control of that individual, and that is experiencing or exposure to trauma. Okay, so I don't think we need to even overflog
I
that
understand.
issue.
I
Yes,
get
so
the difference.
thank you very much. Then let
You
me say something at
listen.
this point. For those of us that lost our moms, our dad, and I also lost my mom and my dad, just at interval of 6 months. My mom died, and due to the shock, my dad also after 6 months follow. But one thing I used to tell people is, anytime you bury your parents, you have to thank God and be happy. The reason is very simple. The prayer of every parent is for their children to bury them,
Very
not the other way
yes.
around. That is one thing we need to know. And if you are able to fulfill that, you should be proud of yourself. The reason why many people are bothered, disturbed is there is what we call in psychology unfinished business. Maybe there are things you are planning to do with them, and the death has cut short of some of these things. So, but the truth is, you have done your part, and people, we have limitations. I used to tell people there are things we cannot control, things like, death and all this. So when they happen, the earlier we realize it is beyond our control and adjust and continue, the better for us. Because if we fail to do that, it will affect other important departments of our life. And even those that died, they may not be happy with us, because their happiness is when we are doing well and when we are living happily, even when they left. So you see, we have to think about some of these things, and when they go, we have to let it go and accept the reality. Acceptance first, that it happens and there is nothing we can do about it. And we have to try and see the positive in it. And one of it is we, the children, are the one burying them, which has been their prayer, and we are also proud of it, because our prayers too is our children to bury us. So you see, These are some of the things that we need to consider, and this is nature, and there is nothing we can do about it. So thank you very much. Let me
Thank you,
not
sir.
dive
Thank you,
into
sir.
counseling
Thank you.
in the class.
This is sounding.
So,
I love that. Thank you so much, sir.
all
Thank
right.
you.
Thank you very much. Yeah. So let me quickly round up this training. We have only 10 minutes to the end of today's session. Now, we are talking about psychosocial support. Now, psychosocial support determine how people handle stress, relate with others, and make healthy choices. And this is the breakdown. We have psycho there, we have social, and we have the support. But in general, when we combine everything psychosocial support, it means there are actions that provide immediate relief, suffering, both emotional and physical, to improve people's short-term functioning and reduce long-term negative psychological effects. Now, if we look at what we mean by psychosocial support, these are a kind of activities we bring and combine with education that will bring immediate relief, especially to the people that are suffering, and also to prevent other long-time negative psychological effect of the trauma and the stress they may have experienced. That is what we mean by that. So in general, the mental health and psychosocial support, this refers to any type of local or outside support that aims to protect or promote psychosocial well-being or prevent or treat mental disorder, mental health issues. So mental health and psychosocial support is any form of assistance and activities with the sole aim of reestablishing a sense of resilience and normality in individual, family, community, and society. So this package is what we integrate into education in emergencies to ensure that we help our children and students and pupils to bounce back and also learn. Now, what are the risks and protective factors to children's psychosocial well-being? This is also important. There are certain risk factors. Risk factors may be defined as threat to physical or psychological well-being. Now, risk factors in humanitarian situations, they may include issues that relate to children directly, or their family or community, or even the wider society. Now, part of the things that we consider as risk factor, especially for our children in humanitarian situations, there are issues that has to do with safety and security, and also exposure or witnessing of traumatic or severely distressing event due to natural disaster, conflict, and displacement. Also, in humanitarian situations, we have issues that has to do with gender-based violence. It is very rampant. It is prevalent in our camps. These are also risk factors to our children. And also increased exposure to different forms of violence, either at home, in schools, and communities. So these are risk factors that are already resident in humanitarian situation. And some of these things, they expose our children to further trauma, stress, and other dangers. Now, loss of family income and livelihood, insecure shelter and living condition, they can also contribute to the stress of our children. Uninterrupted education and even lack of school enrollment, it can also be part of the risk factors. Or destroyed school infrastructures. Some children, when they check and see their schools destroyed, it can also form part of their risk factors to be exposed to some of these things that we are talking about. Caregiver with severe mental health conditions. Sometimes the caregivers, the parents, and the guardians of our children in humanitarian situations, they are also suffering from other mental health conditions. So they are also risk factors to our children. Because when the father, mother are suffering from any mental health issues, they are likely going to maltreat some of these children. Also, bullying, racism, and discrimination, lost, missing family or relatives or friends. These are all risk factors that are already in humanitarian situations. Also, we also have protective factors because these are factors or conditions that attributes in individual families and communities that help people to deal more effectively with stressful events and mitigate or eliminate risks. For instance, we discover that warmth and love from the caregivers, it is protective factors. Children that are having love and warmth from their caregivers, this is another protection against experiencing stress and other things. Access to essential services like education, water, sanitation, and child's protection, it can also be protective, to the child. Safe schools environment and supportive teachers. When the teachers of these children are supportive, and when we also have a safe schools environment, conducive environment for learning, it has a way of protecting these children. There are protective factors that will reduce the stress of the children. They can also reduce their exposure to trauma, and that is why we tag them as protective factors. Then also opportunities for children to express their views, for their views to influence decisions and concern. We should also give a room for children to share their feelings and their thoughts in emergency situations, so that these are kind of things that will make the children to belong and to also share their thoughts. And some of these things can also be considered when we are making decisions. So they are protective factors. And also feeling appreciated and supported. Positive relationship with peers, sense of belonging, and connection to culture. Now, let me quickly look at some of these basic MHPSS activities that we can combine with what we are doing in temporary learning centers as part of our mental health and psychosocial support activities. Now, these activities, they are any type of recreational activities aimed at supporting learners' psychosocial well-being. And these activities, it fosters protection. It also promotes healing for learners living in conflict and post-conflict situations. It increases access to sport and recreational activities for learners suffering from the impact of armed conflict. It also builds the resilience of the children. Now, what are these activities? Can you see my screen from your end? Hello?
Yes, sir.
Yes, sir.
Yes,
So
sir.
Yes, sir.
if you can see my screen from your end, look at some of these humanitarian workers. They are playing with children. Now, after teaching them for 30 minutes, you bring them to other areas, where you can play with them. This kind of play and other things, it has a way of making them to even be healed from other issues that happens to them in the past. Maybe they lost their parents in the course of disaster, and now you are creating an avenue for them to play with adults. So those adults will now be like their parents, and they will forget about some of the things that probably happens to them. So psychosocial support activities, they can be organized into the following categories. We have craft activities, we have drama activities, game activities, music activities that you can do to help the students to overcome their challenges. You can see my screen too, right? So this is also another
Yes.
like cultural dance. You can organize it with them, let them play, let them dance, dance their culture, sing in their, tribes and other things like that. Maybe you take 30 minutes for teaching and learning. then you switch to this MHPSS activity. This is what we do. All our education in emergencies programs, we ensure that we subsume PSS activities so that the children will play, will learn, will play, will learn, will play, will learn until when they are mainstream into a formal system of education. We also have puppet activities, we have relaxation activities, we have visual arts activities as part of MHPSS. We have a lot of activities. There is so many activities that we can introduce them to. And the UNICEF, it has a box, that they used to bring when there are humanitarian situations. All these PSS activities are usually there. They are, for the use for PSS activities for the children. And that is why the UNICEF, they are the one leading education in emergencies. So these are some of the things we do as part of integration of mental health and psychosocial support activities into education in emergencies. One of the reasons why we do that is to build the resilience of these children. And we said resilience is the ability to overcome adversity and positively adapt after challenging or difficult experiences during one's life. So I want us to pause at this point, and our time is fast spent. This is 1 minute after 4. If you have questions or contribution, you can make it as quick as possible. I don't want to take some other facilitators' time. This is a few minutes after 4. Any question, please, from the house? I can still see 2 hands, Kristen and Doshima. Is it an old hand or new one?
It has been an old hand that has not been attended to, sir.
Sorry, sorry, go ahead.
So good. Thank you very much once more.
Yeah.
At least this class is not even only useful to the education in emergency, but personally, it's useful individually.
That's great.
You talked about stress.
Yeah.
You make an example of a man who was rich. Somehow he found himself in, and then he told somebody that he cannot continue with this, citing his example. And days later, he died.
Yeah.
I just believe that was a consign. If you ask me, I want to freely say probably it was a negligence because his problem has been identified.
Yeah.
Yes, and then solution was not offered.
Was not offered, yeah.
Otherwise, I would have said he wouldn't have died. But be that as it may, now there are people who you will come across. You will know that they are under stress. They need help. Because of course, there are people you know they need help, but they don't accept that they need help.
Yeah.
You will try to offer help. They are not ready to accept this help. And if you leave them, something will definitely happen to them, just like it happened to this cited.
Yeah.
From your professional background, sir, what do you advise?
Well, advice is if there are people around them that triggers the stress, or if there are people around them that can do something to reduce the stress, we can also work with them to do that. For instance, tracing the source of the stress is very important. I have one experience, I saw somebody working and all the indicators of stress were on him. So an elderly person like that, I did not want to talk to him direct because of his age and other things, culture. So I called one of his friends and asked the friend to please try and see this man and discuss this issue with him. If he needs help, then he can come to us. Before that man went and talk to the person. In less than 2 weeks, that person died, and his problem was the man was living alone and working in bursary, and he was overworking, and the family and children were not with him. So he was a type of man that carries work to his house. He will work during the day, work in the night, working till the work kills the man. He died in his room. Nobody knew he died until the following day when he did not resume to work. So when people discover he was the type that used to come as early as possible, close late, and 11, 10, 11, 12, he was not in the office, the boss said they should go and look for him. They went to his house and they break in and they saw him seated on his sofa, died like that, watching television. So sometimes when you notice people are really undergoing stress, if they cannot slow down, you can work with people around them. If they have families around them, they can try and see how they can caution the effects of this stress. And so most of these problems sometimes can even emanate from the family. Maybe a woman is not giving her husband the peace needed. So if you people discover it, you can try and see how they can deal with the stressor so that the stress can be reduced. Because stress, it has a way of ending people's life. And that is why I don't joke with stress. Anytime I am stressed, I have to create time to see how I can rest. I can shut down my system, shut down my phones, and disconnect myself from any other thing and just have a 2-3 days straight of rest because of the stress. So thank you very much. This session is, I hope we have not jumped into somebody's time. Of the coordinator, Dashe.
Actually, you've crossed a bit, but the next facilitator is yet to be on call, so
Okay,
I
it's
will
all right.
advise
Yeah,
you
there
to
is no
continue.
problem.
Yeah.
We will continue this discussion as the other persons join. I can also see Doshima, an old hand or a new one.
Good evening, Doctor.
Yeah, good evening.
Thank you once again for this wonderful class. I don't know how to love it. If I
That's
have my
great.
way, I can love it a million times.
That's great. Yeah.
Yeah. So while I was listening to those psychosocial support activities that you were mentioning,
Yeah.
and then I was wondering whether these activities has been integrated into classroom. I don't know. And
Yeah.
if they've not been integrated into classroom activities, how can they be integrated into classroom activities? Because in the part of the country where I come from, there is a lot of crisis going on. And like in my local government, about 15 council wards have been displaced. 15 council wards have been displaced.
Wow,
And
this is
these
serious.
include children who are in refugee camps and all of that. And then I'm wondering because I learned that government usually, fix them into schools. And then I'm wondering that if they can have these activities to also teach them, help them so that they can, come out of this trauma, the stress that they are going through. I feel it's going to be very, very helpful. So I don't know whether it's only in the humanitarian workers that go about, preaching about all of this, and it doesn't get into the real classrooms where these children are. So that's what I'm asking.
Okay, thank you very much. The classification of these activities, some of them, they are indoors activities, some are outdoors. So when you look at the categories, you can easily see them. Like if you're organizing cultural dance and other things, it has to be outside classrooms. If you are taking them on some of these visual arts, for instance, activities, you can also use the classrooms and do some of these activities. painting and other things like that. So, and also the issue of integrating this, we are only concerned with the affected population. For instance, if there are IDPs or refugees, as far as the children are exposed to violence, whether they are in formal school or they are in, these non-formal schools, we can also integrate these MHPSS activities because they are important. We are looking at the students, the children affected, not the system. Because there are times that they are not even living in a camp, they are probably living in host communities. They are displaced and they are living with other people that are already settled in their communities. So we call them, they are living in host communities. They are also attending schools that are formal schools. Even at that, you can also integrate some of these activities. Our aim is to ensure we erase this trauma, this stress they have, been infected with by the nature of the exposure to violence and other things. Some of these things, we don't do them in a normal conventional school because our children are not exposed to trauma. For instance, if you go to any private schools in Abuja, where children are born into a home and from home to school, there is no need of maybe bringing so many MHPS activities because the children were not exposed to any violence. But any group of students or pupils or affected population that are exposed, I think there is need to integrate this into their activities. It is very important. I hope that helps, ma'am.
Yes, it does help. But that's why I was wondering, because in my local government, 15 council
Yeah,
wards have been
yeah.
displaced and they're in
Okay.
refugee camps. So that was, and I think the government was of the opinion that they should get into public schools. So that was why I was asking if
Yeah.
government can
Now that you are
help with.
there, you are our ambassador. You can try and bring up some of these ideas, especially to the critical stakeholders. Let them consider it because the implication is if you don't take care of their mental health, some of these children, they are just in the class, they don't learn, they cannot grow, they cannot develop. They are just watching other things happening because they are being they were exposed to traumatic situations. So, we are trying to do that so that the children can grow along with other children. They can also develop and they can learn. These are some of the reasons why we have to consider their mental health in these settings. Okay? So thank you very much. I think somebody needs to do something. It is good. Yeah. Emmanuel, Ezekiel, I can also see your hands. Okay.
Yes, sir. Thank you. Good evening once again, doctor.
Yeah, good evening.
Thank you. You said something about stress and how you deal with it. What is a professional way of dealing with stress? Because
Okay.
personally, sometimes when I come back with stress, sometimes I'll excuse my child, I'll even excuse my wife. I want to excuse everybody. I can even be shouting, please, I'm stressed. Just give me time. And I believe that is not the best way to handle stress. Or sometimes I may not do that. I will just come and be watching TV, but it's TV that is watching me just because I
Yeah.
want to get my attention to something. So, but
Yeah.
the way you say you take away your phone, do this, do that, do that, I think it's a good way. But what are the more professional way adding to what you just said now? I think it will help a lot.
Okay, thank you very much. You see, one thing in managing of stress, there is no one way of doing that because what you will do to reduce your stress, some people, when they do it, it increases their stress. So it is individual based. But what I do is most of the time, what usually causes my stress is work, especially working throughout the day, presentation, facilitation, traveling from place to place, and working on system. Now, if I want to rest, what I do, because I know what causes my stress, I will disconnect myself from all these stressors because I can pinpoint them. When I disconnect myself from them, I will be taking a lot of water that period deliberately and tea. And also, I will switch to what we call relax, deliberately. I will relax my muscles. Deliberately, I can think about it and relax my muscles and also relax myself. I may not sleep, I may sleep because I hardly sleep during the day by my nature. But if I can do that for 24 to 48 hours stress, my system will be refreshed because I have connected myself from all the stressors. Most of the things that causes my stress is working on system or standing presentation. Like my schedule these days are very tight. I am working on a lot of things, writing proposals in the night, in the day, standing throughout the day, facilitating training. So sometimes it will cause a lot of stress like that. So it works for me. But other people, they need to play with their children. Some people, they need to go out and swim. So just you have to sit and look at your schedules, your stressors. Even avoiding some people may treat their stress. Some avoiding some places or trying to avoid some certain events or telling yourself you will not talk too much or you will not argue. There are so many ways that you can trace the stressors. Once you are able to trace them, then if you want to reduce your stress, disconnect from them. It will help. So thank you. I hope that helps.
Very much, sir. Thank you.
All right, thank you. Kristen, maybe you will be the last person. I can see your hands. You want to say something?
All right, sir. I just want to contribute a little to
Okay.
Doshima about including this in the school curriculum.
Yeah.
Of course, myself, I've been a teacher for some time now, and while teaching, encounter student not giving me the needed concentration,
Yeah.
and also not performing the way they should perform.
Okay.
So in most cases, I think I've discovered one that wanted to even kill herself.
Wow.
I need to
This
forward
is
that to the I forwarded that to the school authority, and then they acted on it, and solution was actually gotten. I've also met somebody who usually she sleeps in class, and
okay.
also got to understand that she takes injection every morning before coming to school, and that makes
Okay.
her to. So now the point, my point of emphasis is this: you don't need to include it in the school curriculum,
Yeah.
but teachers need to be aware of this
Yeah.
so that they can identify it when noticed. So there are signs. Once a child is not giving you necessary attention, I've also identified one where the girl is not staying with her parents. So she
Okay.
walked throughout the night. She
Yeah.
comes to school late,
Okay.
and then closer investigation reveals that she doesn't have time for herself at home. So when she comes, in less than 20 minutes, when she sits down, she starts sleeping.
Sleeping.
So
Okay.
the teachers being equipped with what it takes to identify this, so that solution can be offered in order that teaching and learning will go hand in hand, and also the essence of impacting will not be affected.
Yeah.
And that's Doshima a little bit. So it's the teacher, not the children.
Okay.
Thank you.
Thank you for your wonderful contribution. And once again, thanks to all of you for today's session. All I want to say here is that I have been taking a lot of pounded yam in Makodi. Thank you very much. So have a wonderful weekend. Okay, I wish you all the best. Thank you.
Appreciate
Bye-bye.
you,
Thank
Doctor.
you, sir.
God bless
Thank you
you.
so
Thank
much.
you so much,
Thank
sir.
you.